Hello, everyone. Thank you all again very much for being properly social distance. You can be over there, Mr. Secretary, because Dr. Anton's going to go sit over there. Great. Well, welcome, everybody. Thank you so much for taking time this afternoon for our update with regard to the state's efforts to combat the coronavirus. As always, I start off by reminding people to continue to remember the things we've put in place to be able to help slow the spread of the virus. That includes that 10-person rule, which means that we don't want any public gatherings larger than 10 people so that we can slow the spread of the virus, that we want people to practice good personal hygiene, which means no handshakes, do the elbow bumps or just wave, cough into your elbow, make sure that you're washing your hands frequently for 20 seconds at a time. And then, of course, one of the big keys is if you are displaying those flu-like symptoms, the high fever, coughing, shortness of breath, please stay home. And if you're in one of our areas where we have the directed health measure, especially if you or somebody in your family is sick, everybody in the household needs to stay home, okay? That's one of the ways that we can make sure we prevent the spread of the virus. Now, as we start off the press conference today, I'd like to note that we've got our Secretary of State, Bob Evnen, who's going to be talking about our election. We've got our Commissioner for Labor, John Albin, who's going to be talking about our unemployment numbers. But before we get into that, I'd like to actually start off with some good news. We just found out that our patient one, who was the first patient to identify and be tested positive for coronavirus, who had some underlying health conditions and was on a ventilator at UNMC. We understand that she's doing better, and she is now off of the ventilator at UNMC. So that's great news. I ask for everybody to continue to pray for her so that she can fully recover from this, but that's a great step in the progression for her recovering from the coronavirus. So great way to start, great news. I'd also like to talk about some of the things that the state has done. For example, the fire marshal has waived a provision with regard to fire drills at assisted living facilities so that the folks don't actually have to evacuate, that those facilities can still go through the fire drills, but then they can just notify the residents about how they would behave if there was actually a fire drill so that they would know what to do, but they won't actually have to evacuate and congregate in a group while they do the fire drill. So that's one of the steps we've taken. I've been asked questions several times about the April 1st deadline for property taxes and whether that would be moved, and the answer again is no, those deadlines will not be moved for the property taxes on April 1st. This is something that impacts local government. We need to evaluate what that would mean if we were to do something like that. There's just simply not enough time to be able to do that evaluation, to see how it would impact our local units of government. That provision may not be waived. Certainly there's another deadline that's going to be later this year. We can take a look at that if that's still an issue at that time. But again, everybody needs to still have the expectation that they're going to pay their property taxes April 1st. Now, the federal government has moved their deadline from April 15th to July 15th, as we talked about earlier in the week. I'd certainly encourage Nebraskans who are able to pay their taxes by April 15th, please do so. It's important for state government to be able to have the resources necessary to combat the coronavirus. That's one of the ways that you all can help us out to make sure we can do that. There was also a rumor that somehow Omaha is going to be on a lockdown status in the next 10 days. That is absolutely not true. As I've said, we have put together our plan weeks ago with regard to our directed health measures, and we are at the most restrictive state we are in Douglas County. And actually Douglas, Sarpy, Cass, that whole area, that Omaha area, we are in the most restrictive state, which is, again, bars and restaurants are not allowed to have dine-in. They can only do carry-out, delivery, drive-through, that kind of thing. We've got the 10-person rule there, obviously, as well in those areas. But again, we will not have to do what other states like New York have done with regard to that stay-at-home order, because we are far ahead of where they are with regard to implementing the type of restrictions we've done versus where they were at the same level of virus in their state. So because we are further ahead than states like New York, we will not have to do what they have done. So I want to make very clear that is not going to be happening. We also, I signed an executive order today with regard to daycares. Now, we've published guidance about daycares on our website. That's dhhs.ne.gov/coronavirus. We know that the 10-person rule has limited daycares with regard to the number of clients they can have, the number of children they can take care of. So I have signed an executive order that will allow for nonprofits, churches, hospitals, other organizations to be able to set up temporary daycares. Obviously, the daycare workers will still have to go through some things like the security checks and so forth, but this will allow for temporary daycares in places like churches or hospitals or schools to be able to be set up, to be able to help provide daycare. And again, we'd certainly encourage, please prioritize our healthcare workers, our first responders, police, firefighters, EMTs, correction workers. Those are all people who need to have priority to be able to make sure that they can have the ability to go to work and keep us safe. So again, we did that executive order, so that's an important thing that we've got to take care of, and sure encourage all you to do that. And then also, you may recall earlier in the week, we had the CEOs from Bryan Healthcare and CHI. We just were also notified that CHI will begin doing their own testing starting tomorrow. So again, as we talk about testing capacity expanding, CHI is going to be doing that tomorrow, so that's good news as well. That is a big deal, and again, I also want to remind people that as we expand testing, and our public health labs are expanding their testing, we're seeing other organizations being able to expand testing, we will expect to see that we have got more cases, right? So the number of cases, of confirmed cases where we test somebody positive for coronavirus will go up. That's not going to be a surprise. We expect that. That's going to be part of what happens as we do more testing. And then we also issued a new directed health measure yesterday and updated our ones. So now, just to kind of bring you up to speed again, we've got a directed health measure for Douglas, Cass, and Sarpy County that goes to April 30th. We updated that to include prohibiting elective surgery, as well as that, what I just told you about, making sure that not only if you're sick and you got to stay home, you got those fever-like symptoms or the flu-like symptoms, but everyone in your household has to stay home. So that's part of our DHMs now. We also, because of the cases we have discovered, issued a directed health measure that will include the Three Rivers public health area. Remember, we're changing it from ESUs now to public health departments, those local public health departments. So Three Rivers will be a part of that, and that will include Washington County, Saunders County, and Dodge County. That directed health measure will go till May 6th. So again, we got a new directed health measure there, May 6th. It's the same as the one for Omaha. So again, restaurants are no longer allowed in those counties to have dine-in customers. They have to do only takeout, delivery, or drive-through. Bars cannot have customers inside their buildings. They can do delivery or carry-out package, but they cannot do customers inside their facility. And then we also have a new DHM for Lancaster County as well. So again, we have now more counties that are involved in DHMs, and these DHMs were introduced yesterday will go till May 6th. So that May 6th will also be for Lancaster County. Now, we have been getting a lot of questions, and Martha, I think you just asked this yesterday with regard to the May 12th primary. We are prepared today to say that the May 12th primary will go forward as planned. It is important for us to hold elections. Throughout our history as a nation, whether we've had emergencies such as pandemics or wars or what have you, we have held our elections. We are a democratic republic. And our institutions, such as our elections, are important to reinforce, especially at times like this. So, we will make sure that we continue to support our republic by having our elections. And in fact, if you go back and look at the last pandemic we had elections in this country. So we will continue to have these elections. Our election will go forward on May 12th. It's important for our republic. It's important for us as Americans to reestablish and reaffirm our institutions like elections. And if previous generations of Americans have been able to hold elections through all these emergencies, like pandemics and wars, we can do it today. The Secretary of State is going to talk about some of the things that we're going to do. For example, we encourage people to be able to request an early voting ballot. This is one of the ways that you can vote ahead of that May 12th election. But we will also have our polling places open as well. because Nebraskans like their polling places. Now, we are also going to, the Secretary of State will describe in more detail what he's going to do with regard to making sure that we're taking the appropriate precautions to prevent the spread of virus at our polling places, but we will have polling places open as well. But we will also, like I said, encourage people to request that early ballot, that early voting ballot. We'll do PSAs along this line to make sure we get the word out. Secretary will talk more about some of the steps we're taking there. But again, it is absolutely important and vital for our republic that we continue forward with elections. We must continue forward with this process, and we will continue to do that by having our elections on May 12th. So with that, I'm now going to go ahead and turn it over to the Secretary of State, who's going to talk in more detail about how we will execute on having our elections on May 12th. Mr. Secretary.
Thank you, Governor. Good afternoon, all. As the Governor has just reaffirmed, the statewide primary election will be held on May 12. And our election commissioners, our county clerks, are experienced, dedicated, competent, creative leaders. And we're going to help them from the Secretary of State's office. We're going to help them assure that polling places are open, that they are adequately staffed, and that poll workers and voters are safe. And I'd like to just say a word now of appreciation and gratitude to Deputy Secretary of State Wayne Benna, who has charge of our elections division, and to Wayne's elections division staff, who have done and are continuing to do a remarkable job. They're very hardworking people. They are dedicated to having our elections go forward in a fair and secure way. And our state really owes a debt of gratitude to Deputy Secretary Wayne Benna and the Elections Division staff, and I would like to express our gratitude to them now at this moment. All right, let's talk about voting options during the early voting period. It is easy to vote early by mail. So if you have concerns about going to the polls and you would prefer this time around to vote by mail, it is easy to do that. About 25% of our voters statewide in a typical election vote early by mail. We expect that we will have more mail-in ballot requests for this May primary, and for this particular election, we encourage it. You can request that a ballot be mailed to you early. We are a no-excuse state. What I mean by that is you don't need a reason to request a mail-in ballot. County election officials will begin mailing out early voter mail-in ballots they'll begin mailing them out no later than April 6th. So we'll begin that process no later than April 6th of responding to requests. Nebraska, as I said, is a no-excuse early ballot request state. There's no reason needed. We've had about 50,000 requests so far, and that's a brisk pace. In 2018 and 2016, 59,000 voters voted early. So to have 50,000 requests at this point is ahead of what we would normally experience. The Secretary of State's office is, we've socked in extra early ballot envelopes. We have an emergency supply. We have additional early ballot envelopes for counties to draw upon if they get more requests than they're ready to manage from that standpoint. So we're prepared to have a higher number of requests for early ballots. And our office will send out an early ballot application form to all voters whose county election office has not already elected to send a form. Many counties have elected to send their voters an early ballot request form, whether voters have requested that, asked for that application or not. So there are many counties who are sending out to every voter in their county a request for an early ballot application that people can then return. For those counties that are not able to do that, we will be sending it out from the Secretary of State's office. We will send to the voters in those counties early ballot application request forms. And we anticipate that we'll be sending from our office about 300,000 of those. Now, of course, there are voters in counties that are by mail anyway, and they're not going to be receiving any early voter request forms. Another thing that we're doing here is the Secretary of State's office, in conjunction with the Nebraska Association of County Officials, NACO, is purchasing a ballot drop box for any county that needs one to be placed outside their courthouse. So in every county of our state, if you want to turn in your early ballot, not by mail, but by delivering it, you can deliver it to a drop box that will be outside of every county office in every county of the state. And we're purchasing about 50 of those boxes. We're anticipating that those boxes will be delivered and installed. The secure ballot drop boxes will be delivered and installed within the next, I would say, 2 weeks. Now, voters can use the application form that's provided by the county or the state, or you can print a form from your county election office, or you can print a form from the Secretary of State's website. So there's a number of places where you can access the application form for these early voting mail-in ballots. I would emphasize that the deadline for voting by mail, voting early using these mail-in ballots, is May 1st. So that's the application forms have to be submitted by May 1st. The ballots themselves can be sent in as long as they're received by the end of the election. That's the deadline for that. But the deadline for applying for an early ballot is May 1st. Tomorrow is the deadline for our counties to send military and overseas citizens their ballots. We've had about 450 requests statewide for that. So we're going to begin this process tomorrow by mailing to military and overseas citizens their ballots, and we've granted a blanket approval for these voters to email their ballot back to their election officials. All right, let's talk about polling site preparation for a couple of minutes. We're taking steps to assure that there are polling sites, there are poll workers, and that the poll workers and our voters are kept safe at the polls. So our office has purchased polling site kits for every precinct in this state. Every precinct in this state will have a kit that includes hand sanitizer, disinfecting wipes, gloves for every poll worker, protective masks for every poll worker. That'll be available for every precinct at every polling place in the state. We'll have in place protocols for separation. There is some thought that, well, there are some counties where you're limited, you can't have more than 10 people. Those limitations do not apply to polling places. But although that's the case, we are obviously going to be taking steps to keep our polling sites safe, and we're going to maintain the proper distance. We'll have protocols in place for separation. The Senate bill for this that's before the Congress now contains funding for additional measures that states are taking in light of the coronavirus. And if that funding comes through, as I believe that it will, we will be able to give every voter their own pen to mark the ballot. This time around at the polling places, people will be marking ballots not with a pencil, but with a black ink pen. That's a change. We're going to be using black ink pens starting with this election. And if this funding comes through, we're going to be able to provide an individual pen for every voter. So you go to the polls, you mark your ballot with a pen, and you get to keep the pen. You voted today with that pen. Every voter will have their own. So I think that will come through. There are questions about locations, and we're going to work with our counties to assure that they have adequate locations, that the locations are able to be open to serve as polling places. We're paying close attention to that. In terms of the recruitment of poll workers, I really want to emphasize that service organizations, we have a lot of service organizations in our state. Rotaries, Kiwanis, Optimists, other service organizations, service groups. And they're all looking for ways that they can serve their community right now in the midst of this coronavirus outbreak. One of the ways that you can serve your community right now is to serve as a poll worker. And service organizations can contract with elections. In other words, election workers are paid, and if service organizations provide poll workers, then the money that's earned there can be paid under contract, can be paid to the service organization. It's a contribution to the service organization for use for other charitable purposes that they would like to engage in. So I would encourage service organizations to start thinking in this way. This is a way that you can help our communities. And we're going to work with the counties to help recruit people as poll workers. Poll workers have to be trained. The training will be provided, we'll be providing them with virtual training, online and on television. We're not going to have large groups of people that have to congregate for training. We're finding alternative ways to train people that will be very effective. So those are the steps that we're taking in order to assure that the polls will be open on May 12th and that the polls will be safe for poll workers and for voters. And I also want to again encourage voters to consider voting early, request an early mail-in ballot. Those requests can be made now, and I would encourage people to consider that if they're concerned about going to the polls for this particular election. There are going to be some additional decisions we'll be making down the road regarding the in-person early voting in election offices. That's scheduled to begin on April 13. We're going to continue to monitor the situation. We'll work with health officials and the governor, our counties, our county election officials, and with voter advocacy organizations to determine the feasibility of having in-person early voting at the county offices. We're going to be looking at that, and we'll have to make some decisions about that down the road, and we'll announce that at a later date. Meanwhile, we're going to have a primary election on May 12th. The polls are going to be open, and they'll be staffed in a way that protects our poll workers and protects our voters. And meanwhile, I would encourage people to give serious consideration to early voting by mail and making a request, sending in an application to do so. All right, thanks very much. And
I'm coming up next.
And now you're governor.
Yeah. Thank you very much, Mr. Secretary. And just to be clear, so what the counties or the Secretary of State's office is going to do is make sure that everybody gets mailed out that early ballot request form, correct? So everybody's going to have that mailed out to them. So it'll be easy for them to fill it out, send it back in. They'll get that early ballot. They can either mail it back in or put it in their county Dropbox.
Right.
Great. And that's what we are encouraging people to do, is to fill out that early ballot request form. So take care of it that way. However, if you still want to go to your polls, the polls will still be open May 12th. And with that, now I'd like to call up Commissioner Albin. As you all know, we have seen, especially in the hospitality and restaurant industry, significant layoffs here in our state, though those are not the only industries that have seen the impact. I was talking to a gentleman last night, and he deals with companies that some of which have, as a group of clients, have laid off approximately 13% of the people that they have working for them. So we see significant impact because of this coronavirus to people and families here in our state. Because of that, we have waived certain requirements with regard to receiving unemployment benefits, like waiving the 1 week waiting time. We've waived the requirement that you have to be looking for work or be able to take that job. We are not charging the companies directly for those unemployment benefits as we would in an ordinary circumstance. And of course, one of the things we've seen is that we've seen a significant number of people applying for unemployment. You saw the big numbers that we had today nationally. Nebraska also has seen that. We have seen a record number of people apply of 15,668. Yes. 668 people that have applied for those unemployment benefits here in the state of Nebraska, and that is more than we've ever seen apply in 1 week in our state's history, even more than the highest week during the Great Recession back in 2008. So John Albin, our labor commissioner, is going to talk a little bit about that, but we wanted to make that as part of our announcement as well with regard to those large numbers of folks who have applied for unemployment insurance. John?
Thank you, Governor. All right, well, the numbers speak for themselves in the sense that you can see that we've had a tidal wave of claims filed. If you look at the last week prior to the beginning of the shutdowns, and particularly in the Omaha area, we had 799 claims. And last week we took 15,668. Somebody's math tells me that's an 1,861% increase. I'm not going to argue with it because math was not my major when I was in school. One of the things to note about this is I want to laud my team a little bit. We made a pivot about 4 or 5 years ago to switch to primarily online claims, or at least make that the default option. And of those 15,668 claims that were filed last week, 99.7, I believe, is the percent of them were filed online. So they did not require a human intervention or direct intervention by one of our staff. And I can assure you that had we received that level of claims and been back under our own call-in center or under the even older walk into the local office, we'd still be working on last Tuesday's claims. So I want to applaud my team for the work that they've done in that area to get us moved along. For those of you that are interested in numbers, the previous high before last week was 4,003 claims in a single week, initial claims in a single week. So we kind of blew through all of the records. I think one of the things to note in that is that one of the distinctions is in those cases it was closed downs due to economic conditions. In this case, because of the pandemic, there have been closed downs of perfectly healthy businesses, and so that accounts for a lot of the numbers. We'll continue to see a large number of claims this week. That should be no surprise. This is basically the second week of the process. We're hoping that by the end of next week, we will have absorbed most of the hit that we're going to take in terms of new initial claims being filed, and so we'll work from there. A couple other statistics for those that are looking. Last week's initial claims actually almost matched the entire largest month of the Great Recession. So the volume issue is going to create some issues for my staff in terms of just getting things processed. But I've got people in the office 6 and 7 days a week working on it. In fact, there was a mention last week about a little glitch that occurred in our system in terms of the waiting week. Well, the reason that got fixed by noon of the first day that it occurred was I had somebody in the office at, 8 o'clock in the morning on a Sunday morning, checking the help box to make sure that everything was going smoothly. And when she found it wasn't, we had it fixed by noon. We got a hold of the contractor and we had it fixed by noon. So one thing for all those who did file last week, keep filing your weekly certifications. Unemployment's a little bit different system than some in the sense that you have to file each and every week. Now that should go blazingly fast with the executive order, with the waiver of the wait week, with the waiver of the work search requirement, with the relaxed rules on able and available. We've created a special COVID-19 special queue for all claims to go into so that we can fast track them even further. So we're looking at that. We're also getting some assistance from some of our other agencies. I got a call this morning, or actually an email this morning from the Secretary of State's office and said, do you need some help with your scan? And yes, we needed help, so we've already lined up someone to help us take care of that overload, and thank you, Secretary of State Evnen. There were some issues last week with the call center and people complaining about wait times. With some assistance from DAS Material, we fast-tracked a contract. We will pop up a new call center with 30 full-time seats starting next Monday to address the call-in issue. Again, I can't emphasize enough that it's all there online, and if you can do it online, you're much better off. It goes much faster for you and for everyone else, but we will have more available to answer those calls starting next Monday. And the governor's talked a couple times about switching over staff. We've gone from, we had 34 adjudicators when this started. We had 66 as of Monday. And as soon as we get this contract up for the call center, we'll be able to pull some of the people that were taking phones and move them into the adjudications process. And we're kind of creating a special COVID-19 team so that we can fast track those claims. We're hopeful that there will be this initial surge. We'll get through the surge because you got to. You don't have an option. And then once we're through that surge, then the things should flow pretty well. We'll have some hiccups along the line because the federal government passed some legislation, or at least the Senate did last night. We anticipate that'll come out of the House today. Some of those provisions, heaven help us all, are retroactive to January, so it will create some real nightmares for us administratively, but we'll do our best to get through that as well and make sure that the claims keep coming through. A couple of the press conferences, there's been questions about the independent contractors, the gig economy people, whether there's any accommodation for them. Well, there's not in the unemployment system, but if the House goes along with the Senate Act from last night, there will be benefits available for those who aren't otherwise eligible for unemployment. I think they're calling it pandemic unemployment assistance, PUA. Anyway, I think it looks like it's going to operate similarly to what was done in the past with disaster unemployment assistance, where you'll come in through our system, and if you aren't eligible for regular unemployment, it will pop you over into the pandemic unemployment assistance. So all is not dark, though. I mean, the economy was in really good shape before. I mean, we had 34,000 listings for jobs just before this all hit, and although, you can argue about whether those are available today, you got to think that somewhere mid-April, early May, those jobs are going to start coming back. We certainly saw accommodations and food service took a terrible hit. There, almost 40% of the claims that were filed last week came out of those industries. Those you would think would pop back fairly well. For those that aren't, I know that Director Frakes at Corrections and Director Hilgert over at Department of Veterans Affairs have a ton of jobs that fit into that accommodation and food services, and I think Scott would.
And other things.
And Scott would probably remind me Scott Frakes would remind me very quickly that some of his jobs, not out in the food service part of it, he's offering $10,000 signing bonuses, and I think he told me he had 150 of those positions open. So even though it's a bad week in terms of high numbers of new claims, there certainly are jobs still available, and we will move heaven and earth to help everyone with those jobs. So I think that covers most of what I wanted, and so I'll turn it back over to the governor.
Great. Thank you very much, John. I appreciate that and all the work your team is doing to help accommodate that huge inflow of unemployment benefit seekers and helping those people out. So thank you so much. And again, leveraging the online capabilities to be able to serve that many people all at once. So thank you to you and your team for all the hard work you guys are doing. And then again, it also just demonstrates that we are seeing the economic impact here in our state of the health emergency that we have here. And one of the things I just want to kind of hit upon with regard to that is, again, with regard to if we've got the things that we're trying to practice here around keeping 6 feet away from everybody, the 10-person rule, but we are not shutting down businesses in the state of Nebraska. That we want businesses to take proper steps to keep their people safe, their customers safe and healthy. Practice that good physical distancing where you can, but also understand that we want people to use good common sense and judgment. That if you have a job where you have to be closer than 6 feet away from someone, that's okay. You don't have to worry about that unless your local public health department makes it more restrictive, okay? But in general, if, for example, you're utility workers and there's 2 of you and a cherry picker, that's fine, that you're not more than 6 feet away from each other, okay? So we just want people to remember that we are not shutting down businesses here in the state of Nebraska. Use common sense and good judgment, but work to try and keep everybody healthy and safe, but you're not, just because your job involves being closer than 6 feet doesn't mean you have to stop doing your job. Also, I forgot to give a shout out to Paul Hamill at the Omaha World Herald. He's the one that turned us on to the fact that our patient 1 was off the ventilator, so I want to say thanks to Paul for that. And as usual, then we'll go ahead and address the questions that we have received online. And actually, we only have one person here, Gavin Higgins from KCNI, KBBN Radio, Broken Bow. 2 questions. Residents are concerned that their water electricity is going to be shut off if they can't pay their bills due to losing their jobs or furlough. Is there anything that can be done at the state level to prevent this, or is this strictly a local issue? And we had, Tim Burke was in here earlier this week on behalf of OPPD, but I think it's universal among our utilities that they are not going to be shutting off utilities. They're not going to be shutting off water, electricity, if people have been impacted by the coronavirus. So I would suggest anybody who thinks that they're going to be at risk for that, please reach out to your utility. Find out what you have to do to register with them to let them know you've been impacted by the coronavirus, that your utility should not be turned off. But again, I'm not expecting any utilities to doing that during this public health emergency. He also asked, COVID-19 has obviously had a major impact on our physical health, but mental health as well. Through the emergency funds, aid packages, and so forth, approximately how much money, if any, will be dedicated to mental health services? I think right at this point, it's really too early. The legislature, again, acted quickly yesterday to be able to pass a package to help us fight the corona package. The Congress is working on some other things there as well. So we'll be evaluating what those needs are, but at this point, I don't have any information. It's probably just a little bit too early for us to know what kind of resource will be dedicated to those mental health services. But of course, we're going to continue to work with local public health officials with regard to this and take the appropriate steps. And then Taylor, I think you had one more that was texted in, is that right? Several, okay.
Would like to know, would you suggest that Nebraskans ought to vote by mail or drop off boxes in the May primary election?
So the question from Don Walton, the Journal-Star, was should Nebraskans do that mail-in? Should they do the drop-off? And I would say Nebraskans should vote however they're comfortable. We're certainly recommending that it's a great opportunity to get that early ballot request form, send it back to the state, vote by mail, vote by drop-off. That's a great option. However, if you still want to use your polls, the polls will be open May 12th.
Paul Hamill asked, why was the new quarantine directive added to the latest DHM? One about you need to stay home if you have 2 or more symptoms.
So the question from Paul Hamill is why was the new quarantine directive added to the DHM? Again, it was based upon the feedback we received from folks like Dr. Lawler that, again, when we're looking at trying to slow the spread of the virus, not only if you're sick, you stay home, but everybody in your household should stay home as well. And so that's why it was added there to make it clear, especially in our areas that have a directive health measure, that everybody in the household needs to be home if somebody has those flu-like symptoms of high fever, coughing, shortness of breath, that sort of thing.
William Padmore would like to know, do you anticipate requesting another federal or local stimulus package in addition to what the legislature here and Congress and what Congress is working on right now?
William Padmore has asked, do we anticipate another federal relief package, another federal stimulus package after this one? I don't have any better crystal ball than anybody else. I have heard rumors there will be another package following this one. However, this one, I think, totals $2 trillion or something like that. So I don't know what Congress's intent are. I think the Senate is leaving to Washington, D.C. today, so it will not be within the next few days there's anything like that. But, there is talk of another package. I just couldn't tell you for sure what that's going to happen.
Julie Cornell would like to know the expected turnaround time on tests at drive-through locations. Are they going to private labs?
So Julie Cornell would like to know the turnaround time of those tests at some of the drive-up locations. And again, that'll depend on the facility. So Bryan Health, CHI, I think I mentioned CHI is opening up their own testing facility. They expect to be able to turn those tests around in 24 to 48 hours. I don't know the answer for Bryan. I know that if some of your healthcare providers are using some of the private labs, the turnaround time for those is actually more like 4 or 7 days, 4 to 7 days. But again, I think some of our local providers, if they're doing their own in-house testing, they'll be able to turn those around much more quickly.
She would also like to know, workers who don't feel well can't get access to testing, and employers are asking for testing before allowing folks back to work.
I'm sorry, the siren went by there. Taylor, can you repeat that again, please?
Yeah, she said that workers who don't feel well can't get access to tests, and employers are saying they need to be tested before they can come back to work. How can essential workers who need testing get it?
So again, the question was, if you don't feel well and you need to stay home, again, it's that 14 days plus the 3 days past when you receive or get over your symptoms. And if the employers are requiring that you be tested before you come back to work, you need to wait that full quarantine period. And with regard to essential workers, which Julie was also asking the question on, and this is why as we expand testing, we're going to prioritize healthcare workers, first responders, police, fire, EMTs, correction workers. Those are the people we're going to prioritize first with regard to testing so that if we do have questions, we can make sure those people are back at work as quickly as possible.
David Earl wants to know, what was your initial reaction when you saw that unemployment number? Is it a good idea that those folks stay home for a while and take the benefits to make sure they're social distancing?
So David Earl's question was, what was your reaction when you saw that, and should those people continue to stay home? I would say I wasn't terribly surprised by the numbers because we know that businesses have been dramatically impacted by things like the 10-person rule, people staying at home just in general and so forth, especially people in the food service and hospitality industries that are being particularly hard hit by this. And should, again, should people just keep those benefits and stay home? First of all, the benefits do have a time limit, and so you might want to be cognizant of that. But to the extent that if you can find another job, I'd certainly encourage you to go back to work. There are lots of jobs available. And as we get through this virus and people are going to be going back to look for work, I think you'd be better served by getting that job sooner rather than waiting for when everybody else goes back to look for work. Because if you want to get a choice of the job you're looking for, I'd go start looking for that job right now. And as I said, in corrections and our veterans homes, we are hiring right now. And these are great jobs with great benefits. So I would really encourage people that, yes, take the unemployment benefits to make sure that she can put groceries on the table. But if you have the opportunity to take another job, I would certainly encourage you to take a look at taking that job.
Aaron Hagerty with KMTV would like to know, is the Department of Labor expecting a delay in processing jobless claims?
So the question was, is the Department of Labor anticipating a delay in processing jobless claims? And Don, I'm going to turn to you for that.
Well, certainly the level of claims would say that there will be a delay, but I'm cautiously optimistic that that won't happen to the degree that you might expect, considering that our claims went up 1,861% in a week. Just to give you an example, most of these claims come in as what we call in our industry a clean claim, in the sense that there's a clear layoff, clear eligibility for benefits, clear ability to work, and so you meet those three tiers and you're eligible. But just to give you an example, we had an email from the Ombudsman's office this morning where an individual had said, well, they told me it might be 2 to 3 weeks before I would see my check, and I don't know how or see my payment. I don't know how I'm going to get that far. And we looked in the person's file. We went into the file. The person filed on the 17th. The person's claim had already been fully adjudicated, and they were before the executive order, they'd already received their waiting week credit. So they had basically done what the feds say you should do in 21 days. We had done in 8. And we think there's going to be a lot of claims that are similar to that one in the sense that it's clearly a COVID list, or COVID layoff. We're going to keep a COVID employer layoff list so we don't have to pepper employers with, if you laid off 200 people, we're not going to have to get you 200 times to make sure that, yeah, that was a COVID layoff. I can't make promises, but we're certainly optimistic at this point that we can do better than you would expect, considering the level of claims that were filed.
We have another question for you, John. Is Nebraska faring worse or better than other states in terms of unemployment? Are we still low compared to others? This comes from Grant Schulte. If you repeat the question, that'd be great.
Grant Schulte's question was, how does Nebraska compare to the other states in terms of the level of unemployment? Everything that I have seen says that we're doing the same as every other state. Every state has seen a surge. A lot of them affected by the same sort of accommodations and restaurants business where they've had the large layoffs. I haven't seen anything that says that we are doing worse than anybody else. It looks like we're just pretty typical in terms of the amount of claims that we've had filed.
Great. Thank you, Taylor. That was all the ones we had texted in. Great. Thank you very much. So now, Martha, would you like to start us off with the first question? I see you had your hand in the air already.
I did. I would like to know more about the quarantine, because this is now requiring that someone who has any 2 of the following symptoms, fever, cough, runny nose, sore throat, nausea and vomiting, shortness of breath, that could apply to seasonal allergies, that could apply to an ordinary cold, it could apply to the traditional flu. And you could have varying degrees of these symptoms, and just having these symptoms would not be enough to get you to qualify for a test. So it sounds like you're requiring an awful lot of people to quarantine themselves.
So what we're asking people to do is if you have these flu-like symptoms that Martha just described, again, typically though, fever, coughing, shortness of breath, that sort of thing, stay home immediately, contact your healthcare provider, make an appointment to go in, don't just go to their office, don't just go to the emergency room, And what they will do is they will give you a test for all those other things, Martha, you were just talking about. Because there are, frankly, all the other things that Martha was just talking about, whether it was the flu or allergies or anything else, they can actually sort through that, give you a test for influenza A, influenza B, respiratory panel. They can, your healthcare provider should know if those are allergy symptoms and be able to, if they can do those tests, they can tell you, well, you've got the flu, go home and stay home, but you don't have to stay home for 14 days because you don't have coronavirus. So there are, because we are still ramping up our testing for coronaviruses, doesn't mean we can't test for all those other things. And that's what we want people to do, is just play it safe, go home, contact your healthcare provider, get tested for those other things, stay home until you're well. And of course, until you get tested and find out, say it's influenza A, have everybody else stay home too, so that we can make sure that we slow down the spread of this virus.
But the actual order itself does not say that. It says a period of no less than 14 days.
Right, so we want people to use, if we have to put out some additional guidance on that, Martha, we'll do that. But we want people, again, this is where common sense comes into play. If you go to your doctor and you've been tested and you've got flu, you know you don't have the coronavirus. So stay home until you're better for the flu. So we'll put some guidance out there to make sure we clarify that DHM. But again, we really want people to exercise good, judgment, common sense. But again, if you're starting to show some of these symptoms, make sure you stay home. Yeah.
So for businesses that are staying open and say an employee has a presumptive positive case, does that mean that the rest of the staff in that business should also quarantine for 14 days?
So what we recommend is that businesses contact their local public health department. Again, so if somebody is sick, they should go home. We test whether to see people who are positive or not. So I'm not sure what you mean by presumptive test, because if you've got the symptoms, you're supposed to stay home, and then you can go to your healthcare provider and run through those tests. If you come back negative for those tests and you're concerned you've got coronavirus, certainly you want to contact your employer and contact public health. Public health will do the investigation to see whether or not, who you all talk to, and can also advise the business about what they should do, and also if they think they should be doing, a sanitization, deep cleaning, whatever. Public health can advise the business on what they need to do with that. If the person comes back testing positive, public health can advise that business with regard to what they will need to do to be able to do that deep cleaning. But I think the first step, again, is if you're sick, stay home, contact your healthcare provider, tell your employer, and then the employer should work with public health with regard to what to do if that person actually tests positive for coronavirus. Yeah, Brett.
In some other states, I think the prohibited elective surgery, have we prohibited it? And in some of those states, it's been interpreted to apply to abortions. What's the situation?
So yeah, in our DHM, the question was about elective surgery. So in our DHM, we have, in areas where we've issued those, prohibited elective surgeries, and elective abortions would fall in that category of elective surgeries.
So they are prohibited.
Elective abortions are going to be prohibited, just like every other elective surgery in those areas where we've issued a DHM.
What's the distinction between an elective abortion and a
That would be up to the healthcare provider to be able to determine with their patient. So for example, if somebody's life at stake, that would be considered not elective. So that's really up to the healthcare provider to work out that issue. We're not going to go in and be prescriptive, because there's so many different types of things that healthcare providers have to deal with their patients. But that, you get the idea. Again, we want people to use common sense and good judgment, that if you got elective surgeries, push them off.
Governor, following up on that, in the case of abortion, and there may be other surgeries as well, where time is important in being able to do the surgery, or a certain kind of surgery, but it is something that's not life or death.
Right, again, we're asking people to push off those elective surgeries, and then there'll be a determination made between the healthcare provider and their patient. That's what they'll have to determine whether that's elective surgery and whether it can be put off. And frankly, we're seeing a lot of that now anyway. A lot of people are just deferring, even outside of our DHM areas, are deferring those elective surgeries because they don't want to go into a facility that just soon wait. So that's, again, a decision that's going to need to be made between the patient and their doctor. Yeah.
Because this situation is so rapidly evolving, what would it take for the elections to be postponed or canceled? And are you worried about the virus being passed on, things like that?
So we are not moving the election. Under no circumstance are we going to do that. So answer that question now. Give everybody certainty. we'll be able to get this done. Secretary of State outlined how we're going to do it. And he also outlined all the things we're doing to make sure we keep people healthy and safe to be able to manage it. And that's why, again, we're encouraging people, fill out that early ballot request, get your ballot, send it in the mail, drop it in your drop box, and you can take care of it all right there.
We'll have sanitation kits for county election officials as well who are handling those envelopes.
And mail workers and.
Well, the post office will have their own protocols in place. We'll have gloves and masks and protective gear, hand sanitizers and disinfectants for our county officials who are working on those early ballots.
Andrew.
I'm just following up on Fred and Martha's question, though, in the case of abortion, if the delay goes beyond the second trimester, I mean, then you couldn't have the abortion.
Again, it'll be up to the patient and the doctor to work that out. Martha.
Going back to the various testing for various diseases, and for the coronavirus, some people do not have insurance to cover the cost of these tests, and they do not have the means to pay for it. Is there an option for those people?
I don't believe there's anybody who's going to be turned away to get a test or to receive care in our state, generally in our country with regard to this. Again, contact a healthcare provider, contact a federally qualified healthcare clinic. There's lots of ways people can get this. Nobody's going to be turned away from getting the care they need. And again, right now we're prioritizing testing around people who are going to be the highest priority. We're just making that a priority to get those tests done. This is part of, for example, what we've asked the legislature for, to be able to expand that testing. Dr. Anton, we haven't charged anybody for any of these tests, have we?
There is some talk about covering influenza
Huh?
and the RPP panel. You know,
But that's the influenza panel. What about the coronavirus testing?
No, that should be covered. Totally
Yep, so that's all covered.
But you can't get the coronavirus test until you've gone through these others, correct?
Yeah, I think that's up to the provider, but if you would go to an urgent care center or emergency room, you would be able to get those.
Yep, so again, I think what Dr. Anton's saying is that if you go to an urgent care center or an emergency room, they'll be able to do that. Talk to a healthcare provider. We've got FQHCs across the state that can do this, those fairly qualified healthcare centers and so forth. So I think there's lots of options for being able to do it. Nobody's going to be turned away because of this. And Taylor, did you have something you were adding?
Paul Hamill wants to know, he has a reader asking whether colonoscopies are an elective surgery.
The question is, are colonoscopies elective surgery? And again, I would leave that up to the healthcare provider and their doctor with regard to the specific circumstances. I can tell you one of the things we're always trying to get people to do is do colonoscopies when you turn 50, but a lot of people get them done when they're 51, 52, 53.
I guess, are you gonna be a resident doctor? You know,
Excuse me, I'm going to go over here first, yeah.
In regards to the primary election and poll workers in particular, oftentimes poll workers are older individuals. Maybe for this time around, this upcoming election, you suggest older individuals maybe don't be a poll worker this time and maybe wait till November?
Sure, I'll leave that to the Secretary of State.
Many of our poll workers are older citizens who are in higher risk groups. Obviously, we are encouraging people in those groups to follow the protocols that have been set out here that we've heard all about. And what we're doing is encouraging younger citizens to step up and to serve as poll workers this time around. And who knows, maybe we'll be developing, this is my hope, is that we're going to be developing a new generation of poll workers, and we're going to take this as an opportunity to do that.
Thank you, Bob. Andrew.
I guess, if the doctor performs, I mean, how do you police that? You know, you say it's between the doctor and the patient. Do doctors have anything to worry, or medical professionals have anything to worry about being ticketed or being, I guess, penalized on their licenses if they do these things and they're not proven to be necessary surgeries?
Well, one of the things we've seen from Nebraskans just in general, when we put out our DHMs, is near universal compliance. And again, we're asking people to use common sense and good judgment. For example, if somebody has too many people at a public event, what we've asked the police to do is tell them to get that number down. And while it is a misdemeanor in our DHM areas for you to violate these public health directions, what we really want is for people to use common sense and good judgment, to be able to comply voluntarily, and to use, again, when we're talking about elective surgeries, work with your doctor. figure out what is, if it's an elective surgery for you or is it not. So again, we're just really relying on people to use that good old Nebraska common sense.
And could you explain the rationale behind banning elective surgery?
Sure. The reason that we're prohibiting elective surgeries is so that we can do three things. Preserve personal protective equipment, those masks and gowns and gloves and so forth, for our healthcare providers who are going to be dealing with coronavirus. Second is that it allows us to free up an operating room and turn it into an ICU room, an intensive care unit room. As we mentioned, about 5% of the people who get coronavirus are likely to go to the hospital, and about 1% to 2% will need an ICU room. These ORs also have ventilators in them. So it also frees up the opportunity to have a ventilator available for someone who has coronavirus and trouble breathing to be able to get access to that. The third thing it does is it frees up healthcare professionals who would otherwise be involved in the operating room to be able to work with coronavirus patients. So as we talk about how do we surge the capacity in our healthcare system to deal with coronavirus, prohibiting elective surgeries is one of the ways that does that, because it frees up the PPE, the rooms, the ventilators, and the personnel to be able to take care of those folks who are going to need the most serious care with regard to coronavirus. Yeah, Andrew.
It's an election law question. It has to do with petition drives that are currently going on. And because you don't have the crowds, people can't get the petitions, is there any thought about, flexing that deadline? Or is that just kind of a tough
Right.
call?
Oh, I will tell you, I have no intention of waiving any deadline with regard to when petition filers have to file their signatures for petitions, but I'll also let the Secretary of State weigh in.
The answer to your question is no. We're going to follow the statutory requirements for petitions.
Any other questions?
Yeah, Commissioner Alden, that previous record of 4,003 for a week, was that in the Great Recession?
Yes. That was specifically for the week ending January 9th, 2010.
Is there anything in Nebraska's law that kind of prohibits people from, staying on the sidelines? Like, that was a concern that you could get more by not working and getting unemployment. Is there anything in our laws or the way we're doing it that kind of discourages that?
Well, through May 2nd, when the work executive order puts an end to the work search waiver, there aren't any special incentives to go back, but then that's just part of the social distancing process. It's like to give the people a break during this time period. Then after that, unless it's extended, we'll go back to the normal work search requirements, which is 5 job searches every week.
Prefer to get unemployment than to work because they would, with what Congress is passing, they would make more money that way.
Well, Senator Sass's math is correct. If you were a person earning $880 a week, you will take a pay and then suddenly are drawing unemployment benefits and getting the federal additional compensation. You will take a pay cut when you go back to work. But on the other hand, you've got to remember, if the employer calls you back to work and you don't go, we treat that as a quit. And so that will be the piece on the other side of it. If your employer said, all right, we're ready, let's go, and you don't go back to work, then we treat that as a quit, which is an indeterminate disqualification from benefits. And if my skimming through the 80-some pages of the act that pertain to unemployment alone is correct, would disqualify them then from the federal additional compensation.
But what about somebody that could take a part-time job or take a job in the median? Is there anything that would allow them to still collect some of the benefits minus the ones that they're collecting working, I guess?
Yes, under our statute, since at least my 30 years with the department, you've always been able to work at least part of the time, and you disregard the first 25% of those wages, and then you do a dollar-for-dollar offset against that. So, and as long as you're earning less than your weekly benefit amount, you're eligible.
So again, and John, why don't you just talk a little bit about the STC program for employers specifically?
Oh, yeah. The STC is a program that we have strongly encouraged employers to utilize. Under the STC program, short-time compensation, if you don't like the acronym, under the STC program, an employer can reduce your hours and you can draw unemployment benefits while working for that employer. So say your employer reduced your hours by half and you were someone who would otherwise be eligible for a $440 a week benefit payment, we would give you half of your weekly benefit on top of your employer's salaries. I have not got to the provision in it. There's some provisions in that in the federal legislation that would even help employers pay for their part of the STC program.
Governor, you said CHI would start testing tomorrow. Is that where?
I believe that's in their Omaha location. They're going to be doing that testing for CHI tomorrow. Yeah.
So the commissioner mentioned 40%
Sure.
of the industry for health or for food was from you have numbers like on the second and third highest.
Yeah, we did. The next highest number, which is was surprising at first, but then when I thought about my own dentist calling me and telling me that my appointment had been moved for a month later, the second highest group is healthcare and social assistance, and the third is retail trade. Yeah, 11.6% for the healthcare and social assistance, and 7.4% for retail trade.
Martha?
One quick question for Secretary Edmund. How many counties are sending out vote by mail requests or application forms already?
Please repeat the question.
Yeah, the question is how many counties are already sending out requests, sending out applications for early ballots, and I believe it's about 42. I'm not certain that that's an absolutely accurate number, but it's about 42 counties.
So between the counties and the state, everybody's going to get.
Between the county, the question is everybody going to get one of these? And the answer is yes. Every voter in Nebraska who is not in a county that already votes by mail will receive an application in the mail for an early ballot. And they'll either receive it from their county or they'll receive it from the Secretary of State.
How many counties vote by mail?
11. 11 counties vote by mail now. Andrew?
What's your early prediction on turnout?
I don't have a prediction on turnout at this time. I think it's going to be pretty good, though. I don't think Nebraskans are going to stay away from the polls or not vote because of a microbe. I think that we're going to stand up and we're going to vote. We're going to exercise our rights in this democratic republic, and we're going to stand up and we're going to vote. So I don't think that we're going to have a huge impact on turnout. In fact, I think turnout might be pretty good.
Other questions? All right, I don't see any other questions. Last chance till tomorrow. Well, again, folks, thank you very much. Appreciate you all taking time out of your afternoon to be here today for our press conference and the important things we're announcing with regard to our unemployment numbers and, of course, the election being held May 12th. We will be back here again tomorrow, but again, I want to remind everybody, please continue to practice those good hygiene, washing your hands, staying home when you're sick, all that sort of stuff. That's how we combat this virus. It's something that every single Nebraskan can do to be able to make sure we keep the most vulnerable people in our state safe. Thank you all, and we'll talk again tomorrow. Thank you, Commissioner.